Okay, this is case 5, scope of practice. The background is this case highlights the difficulties of obtaining primary care in medically underserved areas where people have limited access to health services. It presents an ethical dilemma as a school nurse contemplates actions that are out of her scope of practice in order to help a low-income family. In this discussion, we propose a solution to this ethical dilemma and suggest alternative courses of actions that the nurse may pursue.
Question 1 asks, what's the scope of practice for each professional named in the case? For the school nurse, her job would be to evaluate the child, obtain any vital signs, administer medications validated by prescription given to the child, not based on her own preference, but they have to have a valid prescription, refer them to the clinic to visit the dentist for the tooth examination, gather any assessment data that she finds, like the sullenness, the color, the cavity that's seen, and send that with the child to the clinic and follow up on and provide family resources for the healthcare for the family. The dentist would be responsible for providing care that involves removing the tooth and prescribing appropriate medication, as well as consulting with the nurse practitioner on care if they need it. And the nurse practitioner will overlook the clients and the family with their children's care, refer them to case management for resources to cover healthcare costs, such as the social worker, and provide routine checkups, establish a routine of checkups, and any other medical needs.
So question 2 is, how can interprofessionalism address this situation? So while the nurse wants to help in this situation, she has no dental training. So by removing the tooth, she's risking doing more harm and precipitating other complications outside the scope of her training. So while she doesn't want to inconvenience the family, patient safety should come first. So she should work as part of an interprofessional team and try to get into contact with a dentist about a possible emergent situation. And she could also recommend that the family make the trip to the health clinic 2 hours away and call the clinic in advance that the patient's going to be there. And then she can also enlist the help of a social worker, whether in person or virtually, to help obtain the transportation that the patient might need and look into community grants that can help with expenses.
Question 3, what are the risks of administering medications without authority? So the nurse risks possibly harming the patient if she does so. When making a decision to administer a drug, you have to determine first whether contraindications are present or not. And specifically in this case, the nurse suggests that she will administer acetaminophen with codeine, which is contraindicated in children under 12 years old. And she's saying that she's going to give it to a 9-year-old, so that would be a contraindication. And then as far as drug allergies, she risks administering this medication to a patient that may be allergic to these drugs. And she doesn't have enough knowledge to adequately counsel the patients about dosage and side effects, which are important factors to ensure that the medication is taken safely and effectively. And then as for the legal aspect, there are only certain advanced practice nurses that have prescriptive authority. So she would essentially be risking losing her job if she goes through with this.
So question 4, when is it appropriate for health professionals to work outside of the scope of practice? By what is performance outside the scope of practice judged? So the scope of practice may be limited by organizational guidelines. In brief, you should never practice without training in that field. If you have experience, you may be called upon to act as a relief for specialists within that area, but performance outside of the scope of practice is always going to be judged by whatever field you're going to be practicing in.
Question 5, has a school nurse exhausted other courses of action for treating Michael Logan? No, because there might be a dentist in the community who might be able to assist Logan without the family having to make that 2-hour drive. Also, if the family can't go in person to the dentist, they might be able to do a video conference or telephone call to get a dentist to look at the molar and make recommendations. Also, the nurse could ask the community members or family members or local churches to help get funds to help the family visit a nearby dentist.
And question 6, what are the implications of health literacy for this family? Because the family has scarce access to healthcare, it is implied that they may not have as much health literacy when compared to someone with routine access to healthcare. Higher health literacy would help the family to determine which issues can be handled by the school nurse versus which issues should require the 2-hour drive to the clinic for future issues. It is also very important for the Logan family to have health literacy because the school nurse could have communicated the problem with the family and helped them understand what the next step should be.
So in conclusion, while the school nurse works in a medically underserved area and wants to spare the family the financial burden of receiving treatment, this procedure is ultimately outside the scope of her practice. She did not receive the necessary training to successfully complete this procedure and risks precipitating complications that could be life-threatening. The best way for the nurse to do less harm is to enlist her colleagues in providing interprofessional care for the patient.